The birth rate in many developed countries has been declining for decades. The global birth rate has been declining from 2.51% in 2011 to 2.21% in 2021. This represents a decline of 12.7%. There are many factors that contribute to the declining birth rate, including women delaying childbearing, increased cost of raising children, and changing social norms. In addition to the declining birth rate, there is also an increasing problem with infertility. It is estimated that 12 to 15% of couples in Malaysia are unable to conceive after 1 year of trying. This is similar to the global average of 10 to 15%. There are many causes of infertility, including age, medical conditions, and lifestyle factors. There are a number of treatments available for infertility, including medication, surgery, and assisted reproductive technologies (ART), such as in vitro fertilization (IVF). However, these treatments can be expensive and not always successful. The declining birth rate and increasing problem with infertility are having a significant impact on societies around the world. This is a complex issue with no easy solutions. However, it is important to raise awareness of this issue so that we can start to find ways to address it.
In Malaysia, the increasing issue about infertility among couples has become a pressing issue, forcing many to turn to expensive and emotionally drained IVF treatment. This problem happened because of the limited access of fertility care, insufficient awareness about fertility health, and societal pressure. As a result, an increasing number of Malaysian couples are confronted with the daunting prospect of IVF as their sole option for becoming parents. But the question is, how can we work towards making IVF more affordable for Malaysian couples who are facing financial constraints?
First, for those who may not know, let me introduce you to in vitro fertilization IVF treatment. On 25th July 1978, history was made, giving hopes and options to all those yearning for a baby that thought it wasn't possible. On 28th July 1978, the first IVF baby was born, a healthy and beautiful baby girl by the name of Louise Brown. Since then, 5 million of IVF babies have been born around the world. IVF is a complex series of procedures that can lead to a pregnancy. It's a treatment for infertility, a condition in which you cannot get pregnant after at least a year of trying for most couples. It can also be used to prevent passing on genetic problems to a child. IVF involves the joining of a woman's egg and a man's sperm in a laboratory dish. The term in vitro means outside the body, while fertilization means the sperm has attached to and entered the egg. Some of the reasons a couple would choose to get IVF treatment are advanced age of the woman, endometriosis, and male factor infertility.
Firstly, government subsidies. We need to advocate for government subsidies or funding to reduce the cost of IVF procedures for citizens. Secondly, insurance coverage. We need to push for comprehensive health insurance plans that include coverage for fertility treatments, including IVF. Thirdly, public clinics. We need to establish the government-funded or subsidized fertility clinics that offer IVF at lower rates. Other than that, research and development. We need to invest in local research and development to create cost-effective IVF technologies and medications.
Other than that, we can promote non-profit organizations that offers financial assistance or grants for IVF treatments. Local clinics can collaborate with international organizations and clinics to share knowledge and resources, potentially lowering costs through economies of scale. Other than that, medical tourism can be promoted by offering competitive IVF packages to attract foreign patients, generating revenue that can subsidize local treatments. In these strategies and tailoring them with Malaysia's specific healthcare landscape, it is possible to work towards making IVF more affordable for Malaysians in the future.
أنه خلق الزوجين الذكر والأنثى من نطفة إذا تمنى, and that he creates the two mates, the male and female, from a sperm drop when it is emitted. This was explained how males and females are made for each other. Birth of babies could only happen when both males and females are healthy and fertile.
To conclude our TED Talk today, I'd love to quote a saying that goes, No one can whistle a symphony. It takes a whole orchestra to play it. If all parties work together hand in hand, we can make this future possible, where most couples in Malaysia could afford the currently expensive IVF treatment for their future and our generation. Thank you.